Dr. Keith Ablow specializes in adolescent and forensic psychiatry. It's good to have you here tonight, Dr. Keith, once again,
Thanks,
and on this kind of occasion. But you say that there is no safety net in this country for mental health. What do you mean by that?
What I mean is that having turned the decision-making for mental health care services largely to third-party insurers, it is a common occurrence that folks hit the ER having expressed suicidal or even homicidal ideas, and that when they're then questioned a little bit more by an emergency room clinician, they may retract those things, and they then are deemed okay to go home. And why? Because third-party insurers are saying, we're not paying for this person to come into the hospital because he promised, or she promised, more often he, that he would do no harm. Now, listen, if 3 hours has elapsed, what kind of safety net is that? Not to mention the fact that having gutted the community mental health system network, most teachers have no idea that you can call a community mental health center, say, I want to talk to the crisis team, and at least
Dr. Keith, I'm going to jump in for 1 second. Stay with us here, but here's President Trump and Melania Trump at the Broward County Medical Facility, where so many have been treated. Here he is.
And incredible recovery. Incredible. And first responders, everybody. The job they've done is incredible, and I want to congratulate you. Incredible job.
Did you speak with victims, Mr. President?
Yes, I did. Yes, I did. I did indeed, and it's very sad something like that could happen. But the job the doctors did, the nurses, the hospital, first responders, law enforcement, really incredible. The speed that they got the victims over to the hospital is like record-setting. One case 20 minutes and one case 19 minutes from the time of the shot. It's an incredible thing. Thank you very much.
Do our gun laws need to be changed, Mr. President?
All right, so President Trump giving obvious commendation to all of the individuals who were there on the scene and who helped law enforcement and emergency response teams who were incredible and who were, witnessing things that were so horrific, and yet their instincts kicked in. They brought the injured to the hospital and did an amazing job, and we've seen so many of them released and make it through. So all of that good news as the president has arrived in Florida, as you can see, and spent some time at the hospital. One of the last question that was shouted out, Dr. Keith Ablow, what are we going to do now? What comes next? That is the question that needs to be addressed. If you were advising the president tonight, what would you tell him has to be done?
Well, number one, I'd say, please don't get distracted by thinking this is a gun issue. It isn't. All you'll have is a creative killer if you disarm the killer. They'll use something else. The worst episode of school violence, 1927, 38 kids killed by explosives, not a gun. And so what I would say is, listen, this isn't that hard. Most of the assailants are male. Most of them are socially ostracized. Most have a fascination with video games and with weapons. If you have even a coarse filter that leads to a referral to voluntary or even involuntary outpatient medical treatment, psychiatric treatment, inpatient when needed, you will catch 75% of these cases before they ever happen. We say social media is creating this. To some extent it is. But it's also testimony to the fact of how much we're able to ignore, how callous we have become in this safety net, that there's this trail in so many of these cases where you say, oh, it's all over the internet. Well, we've got to give people a known way, like at the tip of their fingers, where they can say, this is what you do when you have these concerns.
Yeah, they have, a teacher has to have the authority to be able to call someone anonymously and say, I'm very concerned that this child is violent. We all know that the things that are opened up by that, but the fact of the matter is that common sense needs to play a huge role, Doctor, right? I mean, we all know the difference between a kid who sketches a gun on with a crayon and someone who is clearly, this young man stalked his ex-girlfriend, said he was going to kill her. To the point where her friends would never leave her alone. So these kids' instincts were very strong, but they obviously didn't have the right people to turn to.
Exactly. And we're so careful to not use the criminal justice system, but we should. If there's
Absolutely.
malicious threatening, that's a reason to go to the courts. The courts can then say, listen, we're not going to come down necessarily that hard. We'll do a continue without a finding with these requirements, outpatient therapy, these medicines. The courts are our friends in this, and it's sort of a court of last resort because we decimated the mental health care system.
That's right.
So we've got to lean on the courts for a little while to enforce psychiatric treatment.
Dr. Ablow, thank you. Good to see you tonight.
All right, Martha, take care.
You too.